The Adult ADHD and ADD Solution, written by Julia Kruger, narrated by Brandy Wulber and Amanda Logan.
Chapter 1. What is ADD and ADHD? Introduction to ADD and ADHD. ADHD, Attention Deficit Hyperactivity Disorder, is among the most prevalent childhood disorders. This learning disorder was formerly known as ADD, Attention Deficit Disorder, and according to the Center for Disease Control and Prevention, more than 6.4 million children have been diagnosed with it. The disorder has an effect on the behavior, learning ability, and emotions of those who are affected. Inasmuch as ADHD is most prevalent among children, it is also common in adults. Those who are affected by this condition in adulthood always start experiencing its symptoms in childhood. The rate of ADHD prevalence amongst school-going children is estimated to be 11%. Most cases end up being diagnosed because ADHD typically overlaps other behavioral disorders that weaken individuals' cognitive skills, thus making it difficult for clinicians to categorize whatever they see. It has largely been claimed that ADHD is a modern disorder, owing to the fact that it has only been on the rise in recent years. Pinpointing the rate of ADHD prevalence in all demographics of the population remains a gray area, because there are glaring discrepancies among people who are diagnosed with it. The situation is compounded further by the fact that mental health specialists use varying criteria to diagnose the disorder. Besides this, cultural factors pertaining to what should be considered normal behavior varies from one place to another. Behaviors that point towards the positive diagnosis of ADHD in some places could be considered normal in other regions. What causes ADHD? Even though no one can explicitly point out the exact cause of ADHD, it has been proven that various factors play a contributory role. Since ADHD symptoms, inattention, hyperactivity, and/or impulsivity affect a child's or adult's ability to get along with others, many people assume that the behavior exhibited by such individuals is as a result of poor discipline, a chaotic upbringing, or even too much TV watching. This is skewed thinking, since ADHD traits run in families. Up to half of adults who have ADHD will end up having kids with the disorder. Generally, there are generic traits which get passed down from an ADHD adult to his or her kids. If an adult has ADHD, there's a 50% chance that his or her kids will have it. Likewise, there's a 30% chance of ADHD being present in a younger sibling if an older sibling has it. Nevertheless, the manner in which ADHD is inherited is complex, since it cannot be linked to one genetic fault. Research also indicates that ADHD can be caused by an individual's brain structure and function. There are various possible differences in the brain of individuals who have ADHD and those that do not have the condition. Even so, the exact difference isn't clear. For instance, studies on brain scans have revealed that certain parts of the human brain may be smaller in individuals who have ADHD compared to those who don't have the condition. Likewise, other parts may be abnormally larger. Other studies have also suggested that individuals who have ADHD tend to have an imbalance as far as the level of neurotransmitters in their brain is concerned. In other cases, these neurotransmitters do not function properly. Pregnancy problems are also likely to lead to ADHD. Children who have low birth weight and those who are born prematurely are likely to have ADHD. Which groups are at risk? Researchers believe that certain groups are at more risk of having ADHD. This includes babies who are born prematurely before the 37th week of pregnancy and those who have a low birth weight. Similarly, individuals who have epilepsy are at high risk of also having ADHD. Those who have brain injury that occurred either in the womb during pregnancy or after a severe impact on the head later in life are also at a high risk of suffering from ADHD.
Sample complete. Ready to continue?